Hello, friends. A very happy new year to all of you. May this new year bring success, peace, and prosperity in your life. May you have a magnificent year ahead. Today is the very first day of my therapeutic dance session, and at the beginning, I would like to share some information with you. First, I want to mention that when I say therapeutic, it doesn't replace the importance of therapy. So, therapeutic practices means that if you continuously practice these techniques, if you make it a habit, if you incorporate these practices in your daily life, you are going to have a better outcome from it. You are going to get a health benefit and overall mental fitness, and it's going to change your quality of life. But if you have a specific challenge, then you must follow the health professionals' guidelines. What I can assure you is that if you follow this techniques, which are mainly based on some simple movements or dance steps, you are going to work on your body and on your brain, which means you are going to have an overall holistic effect that will enhance your well-being in general. So, with that assurance from my end, I want to start today's session, and initially I will say something about this therapeutic session, how I'm going to conduct it. First, I want to mention that when we talk about dance in general, we have a concept that dance means a dancer who is performing on a stage, or it is something a very much aerobic, exhaustive workout, and it's rhythmic, it's complicated. So dance doesn't mean very simple, easygoing thing to us. But to me, dance is a meaningful rhythmic way of expressing myself. So it doesn't need to be always aesthetically very strong. It doesn't need to be very beautiful. It doesn't need to be applauded by others. It's for me. So when I dance, I try to express myself. It may not be acceptable by others, but that is okay. So we are going to focus on this aspect of dance where we do dance for ourselves and we want to express ourselves, we want to improve our skills. It doesn't need to be like a performing art. So what am I going to show you in my therapeutic sessions? First of all, I will show you some techniques through which you can meditate through movements and dance. You can work on your attention skills to enhance your memory formation, to enhance your capacity of learning, to enhance your working efficiency. The second is the capacity to express ourselves, how we can express ourselves through our movements and some simple dance steps. We all have emotions within us, and we are not comfortable to talk about that all the time. And also these emotions are quite complex, and we always think that it is of a high risk to get judged by others, so we keep silent. But struggling with this emotion silently also make a lot of conflict within us. So if we can express our emotions without any further judgment or interpretation, that can vent out, that can give you a way to vent out, and that can release yourself from that stressful struggling with these complex emotions. So I will show you how you can do that through dance. Then I will work on your body-mind coordination skills. If you have a good body-mind coordinations, you're actually practicing mindfulness, And when you are practicing mindfulness, you are in a better position to handle all your negative automatic thoughts that always come and interfere with your present moment. So that I'm going to show you how you can develop those mindful skills through movements and dance. And finally, I will show you some ways to enhance your creativity. Creativity is something that makes us being more dynamic, being more versatile, and thinking out of box. If you can think out of box, if you can imagine very efficiently, then even if you are in a stress and if you can take yourself out of that situation and try to imagine something pleasant or peaceful, after a while you may have a better interpretation of the present moment and you may get a new resolution for the present challenge. So I will show you how you can be more creative, how you can change your perspective so that you can handle your issues more efficiently. Now I want to say why I have chosen movement to be the tool for my therapeutic sessions. Movement is a very innate and primary characteristic of living being. Movement and locomotion differentiates us from the non-living world. And if you follow the evolutionary tree, how we have evolved as human beings from our lower primates, you will understand that movement is one of the process, one of the physiological function that has been evolved from one species to another species. And in case of us, the human being, movement is very planned, very skilled, very much integrated and very much complex. How it happens? Because for us, the planning of the movement has involved the contribution from the frontal, prefrontal cortex and other higher order mental functions driving areas of the brain. So if you consider, the whole brain and spinal cord is actually almost involved in this movement procedure, along with the muscles, the joints, the appendages and the sensory organs. So if I talk about brain, it starts from the frontal cortex, then the parietal cortex, basal ganglia, brainstem, coming down to cerebellum, pons, then going down to the spinal cord. There are the motor neurons. All are actually getting fired for only one movement. And as you know, there are some movements that we control and there are some movements that happen automatically, like your heartbeats. You don't control your heartbeats, but you control your appendages. So this distinction of movement is also made by this system. So you can imagine that how complex is it. And when you utilize this movement tool to improve your brain functioning, you are actually working on the whole system. Now, I want to come to the point how our movement is so much planned. So, planning and execution of our movement depends on our higher order mental functions. There is a particular term which is called executive functioning. This is a kind of governing function in our brain. What it does, it tries to organize, prioritize and regulate different functions together. So even if you do a single task, it actually needs a lot of micro tasks to be performed at that moment. So this executive functioning system is like the head office. It's like the head administrator who regulate all these things together and bring about the final outcome. So this executive function is very much involved with this movement. And movement in this executive function, co-evolved through the evolution. And that's why human is so unique in case of planning and executing any movement. Now I will talk about a research article that I published in 2022 from Indian Journal of Mental Health, where I reported that the performing artists who are either dancers or musicians or vocalists, they have a better memory skill than the people who are not involved in this kind of performing arts. So that led me to think why it is. And when I dived deeper into the literature, I found that this kind of dance and movement is really getting a platform for various diseases to be treated with some alternative route therapy, like anxiety, depression, bipolar disorder, all these kind of mental psychiatric disorders. Then coming to the dementia, Parkinson's disease, there are also reports that in these cases, Parkinson's, Alzheimer's, cognitive impairment, these dance and movement therapies or interventions are routinely being taken up, and that shows some positive effect. And finally, I will talk about the cancer survivors. Now, research has been extended to utilize dance and movement therapy for these cancer survivors. And all these genres of diseases, the sufferers, all have mentioned that this dance movement therapeutic intervention that has improved their life quality, that has reduced their perception of pain and stress. They have increased their frustration tolerance, and they have gained confidence, and they don't feel much neglected anymore. So even in case of these patients, the dance and movement therapies that has improved their life quality. And of course, in case of people like the healthy peoples who are not clinically diagnosed with any kind of diseases, there also dance has improved attention skill and memory skill. It's similar like what I found in my research. And also in case of planning, decision making, emotional regulations, and cardiorespiratory fitness. So I will upload weekly tasks or challenges which will be based on some simple movements and some kind of cognitive function development tools. So it will be simple tasks, but if you perform that continuously, you are going to improve your working memory skill, which means that we always have memories in our long term and short term forms, something from the old time and something from just now I'm talking about. But when we want to utilize that memory, when we want to execute the task, we take those memory in our mind and package it in a usable form. So this packaging of memory in the usable form is known as working memory skill. So the techniques that I'm going to show you will enhance your working memory skill, will enhance your mindfulness skill, and will enhance your creative skill. So all this together will help you to know yourself better, to know your potentials. We as human beings have enormous potential to do multiple things, but we hardly realize that how voluminous potential we have. So if you can push your limits with small tasks, with small goals, you are going to gain that confidence of self-ability, and that will help you to achieve your targets, and that will help you to actualize your potential. And this in long term will help you to keep yourself happy, to be more resilient, to deal with stress in a better way, and to find a meaningful life. So, are you ready for these weekly challenges? Let's dive in together. Today, we are going to begin our session to practice to improve a very basic but a very important physiological function. It is breathing. And most of us think that breathing means we are just inhaling our air inside and we are exhaling that, and breathing is only about that. But actually, breathing is a very orchestrated function between your respiratory system that involves your nostrils, that goes down to the pharynx, larynx, bronchus, then it branches to the alveoli into the lungs, and then the cardiac system that involves your heart, arteries, veins. It also involves your nervous system, your parasympathetic and sympathetic nervous system. So when we breathe, we are actually integrating all this respiratory, cardiac and nervous system together to have a proper breathing frequency. Now, when I talk about breathing exercises, I mainly talk about slow breathing exercises. The first benefit from slow breathing exercises is that it can handle or it can improve your dead space, your respiratory dead space issues. What does that mean? When we breathe, we inhale the air, but all our alveoli inside the lung, all the alveoli do not get enriched with oxygenated air. There is always a lack. It can be a physical lack that we don't inhale a lot, or it can be a physiological lack that the alveoli, the sac, that do not get enough diffusion of oxygenated air. But whatever it is, the main thing is that we may have inhaled a lot of air, but when it comes to the lung, it gets some portion of the air that gets trapped, and that portion is called dead space. If we do slow breathing, which means we can slow down our breathing frequency less than 10 per minute. Ideally, research suggests that if you can reduce your frequency to 6 or 8, that has a very good effect. But since usually we have a frequency of more than 10-12 per minute, so it is not easy to reduce the frequency to 6 or 8 at a time. So if we can practice reducing the frequency from 10 to 8 to 6, we are first going to work on this dead space. And along with that, it will have a calming effect on your whole system. So if we do the slow breathing technique, we are actually feeding more to the vagal nerve regulated breathing system. So that is very important, and through this enhancement we can also regulate the stress, immediate stress response on our respiratory system. So what happens with the slow breathing? You get an overall benefit of health. Every day, if you can practice these slow breathing techniques, you are going to hold a grip on your breathing efficiency, and if you practice it continuously, it will be reflected in your daily life. So I will show you how to do this slow breathing. First of all, when you take this kind of exercise for slow breathing, the first thing you have to remember is that you have to be on a resting state, and you have to be peaceful, calm and concise. Leave all your worries, all your thoughts behind, and just focus on your breath. And then try to inhale as much as you can so that your thoracic cage enlarges and your diaphragm goes down. Allow the breath to stay inside, and then exhale in a controlled manner. So if you count your inhalation with 4 counts, and then you gradually exhale it in 6 or 8 or 10 counts, it will help you to hold a grip on your breath, and this will also help you to reduce your dead space, because you are giving more time to get this oxygenated air diffused, and you are also working on this very heart rate variability factors. So in a nutshell, soft breathing will give you a lot of benefit silently but consistently. So Let's practice soft breathing.